Gabe Farias here with Jill Piazzi with Gray Matters, one of the clients at Jaeger FC. Jill, thank you so very much for taking the time to join us on a beautiful, what's today, Wednesday? It's already Wednesday. Can you believe that? Jill, Gray Matters. Right quick, talk about the services that you offer, because they're tremendous as it pertains to how you guys really care for senior citizens.
Thank you, Gabe. So I do in-home assessments. I go in and do a comprehensive assessment and then develop a plan that serves that older adult mostly. I'm looking at all facets. I'm looking at medical need, financial, how am I paying for the care? I'm looking at their mental health needs, legal, the whole gamut. So it's a comprehensive assessment. I'm helping the adult child figure out how they can best care for their parent, even if they don't live here in San Antonio. And I also consult with families. So a lot of consultation and guidance.
So growing up, I wanted to be an astronaut. That was my dream. The problem is I was really obese, so I knew that I wasn't going to fit into, a spaceship someday. Why are you laughing? So growing up, you had a bit of a different dream, a passion for what you wanted to do. Tell us your story on how you had this kind of calling to do what it is that you do now.
So as a kid, actually living in the projects in San Antonio for a short period of time, I had neighbors that invited me to a nursing home and some girls that lived next door. And so I went, didn't leave there feeling real good initially, but it became a challenge to see if I could go back and see if I was scared or if I was, stressed. And so it became a constant where I'd go volunteer. I got to do physical therapy. I got to help people in activities. I fed people that were blind. I helped make phone calls back when we had payphones. So they were in a wheelchair and I'd put the quarter in. So I did a lot of different jobs, but I really felt like that was my calling, to work with older adults even at a young age, to serve. And I felt like I had a bunch of grandparents, so it was pretty cool.
Talk about how long you've been doing this professionally, Gray Matters.
So I've had my business for about going on 13 years in San Antonio, but I was also in Austin, Texas doing this years back. So over 15 years total. But I've been working with older adults for going on 34 years. So I started in nursing homes as a social worker. I've managed assisted livings and just done the gamut, even worked in mental health with older adults.
When we first started doing some research on your company, I thought it was like just greater San Antonio, kind of inside 1604, but your service area is tremendous. Talk about the reach that you have for what you do.
Right, so I'm covering San Antonio and surrounding counties. I go as far as Uvalde. I have a client in Uvalde that I see once a month. I'm going south of San Antonio, so pretty much Central Texas. I cover for a large region.
Talk about some of the partners that you guys use for some of the services. Obviously, you can't do everything. Who are some of the partners that you guys use, and how do you guys work together to accomplish this great goal?
As an aging life care manager, we do depend on different companies to help our clients. So I'd say a big one is personal assistance services, licensed caregiving agencies. I'm referring my clients to get care in the home, whether it be direct care like hands-on or homemaker services. I also utilize home health if people need therapy. I'm utilizing hospice if they have end-of-life needs, elder law attorneys to draw up their estate plans, and then financial planners on occasion. But I also use nonprofits like Meals on Wheels and various groups for transportation.
So we know how important and how beautiful it is what you do for the seniors and the elderly population. I'm amazed, as somebody who has an elderly father who I know I'm going to be probably calling you to help us with someday. Talk about the folks that you're helping that aren't the seniors, the kids of the of the elderly, in some cases the grandkids of the elderly that are taken care of. How satisfying and how wonderful is it to know you're helping those folks out too?
Right, so it's important to have those support systems, right? Even if they don't live here. I have adult children that live out of state. So it's being that conduit, that be the information provider and the support and advocate from a distance, and I'm providing them information. So I have to keep them in the loop, especially if they're power of attorney. So I'm sending them documents. I'm keeping them in the loop via email or phone calls, and it's a constant. It's not just 9 to 5, it's after hours because they're on a different time zone, or it's a weekend because problems don't stop on weekdays. So I'm working with families, I'm guiding them, I'm also helping them through family dynamics that are going on. You know, sometimes not all families get along.
Sure.
So it's really working to help them figure out ways to work together and to communicate better.
And the word advocate is a perfect word to describe what it is that you do. But to me, you're so much more than just an advocate. You're an advocate, you're a voice, you're a friend. Talk about the personal relationships you build with these folks that in some cases they may not necessarily need to be bathed, or they not necessarily need to have they just want someone to talk to and to be there for them. Talk about the importance on the personal side of what you do.
Right. Well, first of all, you have to build that rapport and trust.
Yeah.
When you walk into somebody's home, they may not want your help. So you have to quickly build that trust and rapport. But I do develop relationships. If I've been with the client for years, you become like the family member. You know, I'm there for the birthdays. I'm there for the hard times. I'm there when they lose their spouse. I'm at the funeral. I'm there through good and bad. So it is important to have those connections and to have that close relationship.
Yeah.
You know, we all want that as we age. We want people we can count on. And, you know, some of my clients never had kids. So there may not even be family.
Wow.
I'm not just working with the adult children. I could be working with a neighbor.
Yeah.
Who may be older themselves and they're just trying to help their neighbor, you know?
And the range of emotions that you have to go through for what it is that you do, how do you do that? I mean, it's an odd question, but just sitting here thinking about this conversation, you've got to deal when in some cases the person does enter that kind of senior part of their life to the point where, you know, you're burying them and you're having services for them. Talk about the range of emotions that you have to go through.
I've had to develop a thicker skin through my years in the industry. It's learning to kind of compartmentalize, you know. How do I separate, even though it's difficult, because I do think about my clients after hours. I do worry about them. So it's being able to accept that we're all going to pass, but also to say, I'm going to make sure that client has a good death, you know, and that their wishes are upheld. But it's being able to just be grateful for the opportunities to get to know these people on a personal level and just separate it out as best I can. I try to do good self-care also. You know, I have to take care of myself, doing things like yoga and just prayer and different practices so that I can be able to serve. You know, I can't serve if I'm not healthy.
Yeah. Do me a favor, in one quick sentence, sum up what it is that you do and how you can help our elderly population.
So I'd say that I'm the advocate for the older adult and the family, the significant others. I'm here to be their voice, but I'm also here to be the problem solver and to jump in as needed, you know, to be there constant, or I could be there just if they need me a year out. You know, I help people at different times in their lives.
And how can, before I ask the how can we get in touch with you, would I be a difficult senior, or do you think I would be?
You'd be the fun one.
Really?
Yeah. You'd keep everybody
funny
laughing.
How? Do I amuse you? Is that what
No,
I'm joking. I'm
you're
teasing.
the comedian, so
you know, well, there you go.
You'd be keeping everybody on their toes.
You ask my wife. I think she says you would be the needy one. That's what she says, and I'm like, yeah, you're right. I'd be the needy one. How can folks get in touch with Gray Matters?
So they can call me on my cell at 210-363-3554 is my personal cell, my business cell, or they can email me at Gray, Gray Matters, MATTERS 64 at Gmail.
And you've got a fancy new website that people are going to be going to here really soon. So what's the website?
The website is graymatterscare.com.
graymatterscare.com. Jill, thank you so very much for taking the time. I appreciate
it.
it.
Thank you for
Jill,
all you do.
Yeah, so for Jill Piazzi with Gray Matters, I'm Gabe Farias, wrapping up another edition of the Jaeger FC Community Spotlight. Folks, have a great day.
Bye.
And